And now I'd like to introduce Jessie Johnson of the Hearing and Speech Center of Northern California. She is the clinical practice manager and director of counseling and outreach. She is intimately familiar with the complex process of obtaining hearing care from insurance companies to the range of hearing aid models available. And a little bit of a fun fact, she is also conversational in American Sign Language.
Hello, everyone. Please feel free, like Tuan was saying, to ask questions throughout the presentation. I want you to get the most out of our time together today. And I can talk about hearing loss all the time. So I'm happy to give you the information you're looking for. A little bit about myself. I've been with the Hearing and Speech Center now. It'll be my 21st anniversary with the Hearing and Speech Center this month. So I've been here for a long time, working closely with my audiology and my outreach team. I give a lot of educational presentations throughout the community, as well as do hearing screenings and work with our audiology team with hearing aids and insurance. So I'm pretty knowledgeable when it comes to particularly about insurance and how to access, use your insurance to access your hearing aid benefits. If you don't know about the Hearing and Speech Center, we're located on Divisadero Street between Eddy and Ellis. We offer audiology services, speech pathology services. We mostly see children in our speech department. We have a counseling department. We have a licensed clinical social worker on staff. We have an education department, and then we do a lot of outreach. Normally, one of the big things I like to boast about is that we have a parking lot with free parking here in the city if you come to visit us. But because of COVID, we actually haven't been using our parking lot because we want everybody to come through our front door. But soon, hopefully, if you visit us throughout the rest of this year and next year, our parking lot will be open again. So just to talk a little bit about hearing loss, this is a slide that I stole from CapTel. They're a captioning telephone company, just kind of to talk a little bit about how much hearing loss there is in the United States and how much it can affect us and our loved ones. 48 million Americans are diagnosed with hearing loss. The average percentage of people over the age of 65 that have hearing loss is about 33%, and that number goes up over the age of 75 is usually 50% and up. This slide is actually a little bit off on the percentages. Men are usually twice as likely to experience hearing losses than women. When we get older, we start to lose our higher frequencies. The higher frequencies start to get lost, and that makes speech comprehension more difficult. So, and then there's a bunch of other new studies out right now about the correlation between hearing loss and cognitive decline. So we can talk a little bit about that as well. So today, mostly I'm going to talk about presbycusis. Presbycusis is this typical hearing loss in an aging adult. So if you have ever had your hearing tested before, you might recognize my little slide, but we have our frequencies, the sounds that we hear from across the top. We have from low frequencies up to high frequencies across the top. And then from up and down, we have soft sounds to loud sounds. And this, if you see this red line that I have, that would be like a hearing loss that's been plotted on this graph. That red line, everything below the red line, as you can see, is a little bit darker, and everything above it is a little faded. And that means that's because we would be missing those sounds above the red line. Typical hearing loss in an aging adult looks like this, where you're losing these high frequencies. And one of the things to note about this on this audiogram is that little kind of boomerang shape we call the speech banana. The speech banana is showing us where some of the speech sounds fall. So important to note those F, S, TH, those are up in those higher frequencies. So it would be really difficult for us to understand this with a hearing loss like this. So the fat, sat, that, be really hard to differentiate those words. You'd hear the at, those consonant sounds come through, or the vowel sounds come through, but the consonants you're going to be missing, the F, the S, the TH. So you have to, if somebody said something with you missed, you're going to have to use the context of the rest of that sentence to fill in for the word that you missed. And now we're pulling other resources from our brain to do that work. So thinking about hearing loss, it's not just our ears that are doing the work. It's really our brain that does the work. Our ears are just capturing the sound to get it up to the brain so the brain can process. So it's important to have the function working of being able to get the sound to the brain. And when we're not getting the sound to the brain starts to lose its like neuroplasticity, where it is getting that information and what it should do with that information. And it can rebuild once it gets that sound back, and we can do brain training to get that sound back. But it can get more difficult for some people, and it can get more difficult the longer we wait. If we don't do something about our hearing loss, it's more of a struggle, just like getting out of shape, and how it's harder to get back in shape the longer we wait. So thinking about the brain is a big part of this. It's not just as simple as putting hearing aids on. It is putting hearing aids on possibly to get the sound to the brain, but then the brain having to like relearn what to do with that sound sometimes. So our brain does 4 key tasks. It is figuring out what's happening in the environment so it can orientate itself. It's recognizing what the sound is so it can make sense of it. And then it's focusing on what's important and separating the competing sounds out. So really think about you were standing in a group of a few people talking, and you're having a conversation with the person next to you. You can hear the other people talking, but you're focused on the person that you're conversing with. And then suddenly something triggers your attention. Maybe somebody said your name, and suddenly the person you're talking to is no longer the one that's most important to you. The other person is. So you're now focusing over there. So your brain just did that. Your ears collected the information, but your brain did that focus and separation. So when our brain's not involved anymore because we can't get the sound, that's when we start to see that there's some kind of breakdown happening. And that's what a lot of the studies that have been being looked at right now. Some of the big studies, if you're interested in looking them up, are on Johns Hopkins, National Institute on Aging. They're looking at the effects of hearing loss that's untreated over time. And they're seeing that the risk for dementia and cognitive decline is higher in those with the untreated hearing loss. And then they're looking at interventions. So is simply putting a hearing aid on going to be enough to delay or improve that decline that could happen? And so that's what the big question is right now in a lot of the studies that are constantly being looked at. So it's one of the risks in reducing, it's one of the things that we can do to reduce our risk for dementia, just like, physical activity and social contact, but so much of that social contact is being able to communicate and hear. So that's why the hearing loss comes into play as well. We look at things like not being able to participate in social events can lead to isolation. Isolation can lead to depression, and depression can be a risk for dementia as well. So all of these things are kind of tied together. So what can we do? A lot of times the first question that comes up is hearing aids. So today I'll talk about hearing aids, but there's also assistive listening devices. Sorry, my screen jumped on me. There's also assistive listening devices, communication strategies, support groups, counseling, lip reading or speech reading classes, making environmental modifications, and then oral rehabilitation. So oral rehabilitation, similar to physical rehabilitation, where we're doing some kind of rehab with sound in our brain to try to get it working and functioning again. And there's some new programs out for that as well. So I'm just trying to keep an eye on the Q&A while I am also going through these slides to make sure I'm answering questions. So hearing aids, there's so many options out there. There are different styles, there's different technologies, there's different manufacturers, there's different places you can go. So I'll try to kind of briefly go through some of the options so you have a better understanding of what's available and what you're looking for if you're going to go talk to somebody about getting a hearing aid, just so you feel more informed as a consumer. There's a lot of styles of hearing aids. Usually cost does not come into play when we're looking at a style. Style is more for how much power we need to push through the hearing aid to get into the ear. Might depend on what style you can get. You might not be able to get a really small hearing aid if you need a lot of sound, a lot of power. And sometimes it can depend on the shape of our ear canal as well. If you have a really tiny ear canal, you might not be able to get a really tiny hearing aid in there. It won't be able to fit all the things inside the hearing aid that we need. The most common style of hearing aid on the marketplace has been the ones that are on the left here, the receiver in the canal style. That has been about 70% of the marketplace. It's kind of cool because it has a thin wire that comes down into the ear, and then a hearing aid that sits behind the ear that's not very visible. And it leaves the ear canal a little bit more open. So those natural sounds that we might still hear in the lower frequencies are kind of coming into the ear and not being processed so much, but the higher frequencies that we're missing are being processed. So it's been a really common style for people who really like it. One of the changes I've seen in the past year because of COVID, and we're wearing our glasses and we're wearing our mask and we have a lot of things behind our ear, is people have been going to more of on the right-hand side, the custom fit hearing aid. So it's completely in the ear canal. So it's not behind the ear and not getting involved with our mask. Because that's been a big change in the industry this year, is people moving back to this custom style. When we're talking about cost for hearing aids, it's really more about the technology that's inside that hearing aid and the features that were turned on in the technology. So most hearing aid manufacturers will have about 5 different technology platforms. So kind of an entry level or basic hearing aid all the way up to like their most premium technology. And then the tiers going up, the price will change. So it can start off anywhere, depending on where you're going, anywhere $800-900 at the beginning for one hearing aid, all the way up to $4,000-5,000 for another hearing aid, premium technology per ear. So it just depends on where you go, what technology you choose, how much warranty is within service that is included in the cost of the hearing aid. So one of the things that I often say is if you're going to go somewhere, find out what services are included. Many places will include, a lifetime service on the hearing aid. You can go in at any time for no cost. But really you are paying for that. You're paying for that up front, and the cost of the hearing aid will probably be significantly more at a place that does that. And then find out what warranties are included. Most manufacturers are going to give you at least a standard 1-year repair and 1 year of loss and damage. And those warranties will go up with the technology, but also some places will automatically add additional warranty into the hearing aid, so the cost will go up then as well. But most importantly, if you're looking at a hearing aid, I always say find an audiologist or a dispenser that listens to your needs and wants to work with you to make the best fit possible, because hearing aids aren't an exact science of us just plugging in your hearing loss and the hearing aid works for you. We have to make adjustments. We have to make modifications, and it takes some time to do those tweaks and make sure it's functioning for you. So you have to come in and say what's working or not working, and the audiologist has to make some changes so that it does work better. And you want to have a good relationship with that person, and you want to feel like that person's listening to you and wants to work with you to get to that goal. So you should never feel uncomfortable or pressured when you're seeing somebody. Insurance is a big thing now. So the last few years, that's been a huge change that our Medicare supplemental plans will have coverage for hearing aids, which is great in some ways and sometimes frustrating. So, so I'm going to talk about that in a second, but other things to know is like to do your research, to look online to find out where you can go in your area and get some information. I do not recommend buying hearing aids online because you do need to have someone provide the service for you, and that's a big part of it. And then just know that there's a California state law 45-day trial period that you purchase your hearing aid and you can return it for a full refund. And you shouldn't have any sales pressure on you. It's a big decision and it's a large amount of money. And then to always bring in like where your current hearing challenges are. So if you're struggling with your spouse when you're at home, or restaurants are difficult, or the phone, or it's nice sometimes to be able to bring a spouse or a loved one with you because they have a perspective on where your challenges are as well. And we can't fix a problem that we don't know about. So it's always good to come in with those. So going back to the insurance and the Medicare supplemental plans, a lot of these plans will have some kind of benefit for a hearing aid. So that might either be it'll cover the cost of one hearing aid, and usually that technology is going to be the lower end technology that you could get maybe at no cost. And then if you wanted to upgrade, you would pay out of pocket to get a higher level of technology, or it might just be a reduced cost where they're taking $1,000 off the cost or something like that when you go in. Mainly what they're doing is the insurance company, I'll take Anthem Blue Cross. Okay, so Anthem will have a covered benefit maybe on your plan. They're going to partner with a third party organization who they will have predetermined with a third party. Here's the hearing aids you can get at these price points. These are the manufacturers we're working with and the products that are available. And then from that point, this third party partners with providers like myself at the Hearing and Speech Center, where they would send a referral to us and say, okay, you can go to this provider and get your services done there. So it's great because in the past, I've been here for a long time, a lot of people didn't have hearing aid benefits. They didn't have coverage. So there wasn't any help in that area. So those new supplemental plans are providing help, but they're also kind of limiting who our provider choices and what hearing aids I can get, because they're predetermining what's available for us. So that can be sometimes a challenge. Hearing aids are super smart now. So we have this really cool technology that allows us to have wireless connectivity. So the hearing aids talk to each other. So it does cool things like if I press the right side, I can raise the volume in both hearing aids. If I press the left side, it lowers the volume in both hearing aids. That's pretty cool. But really, it's doing a lot of work for your brain. So your brain doesn't have to process timing and loudness differences happening in the room. So it makes it a very smooth sound. It transfers information really fast. So it allows you to do connectivity, some other devices. Some of those other devices we can connect to are our cell phones, or maybe a TV device that hooks up to our phone, or even an external remote microphone that we can use. So this wireless connectivity is really cool. And that leads to these accessories that I have on the screen. This is just an example from one manufacturer, but you can get a cordless phone for your house. So it just looks like it works as a standard cordless phone for anybody else in the home. But if you pick it up and it wirelessly connects to your hearing aid, so you'd be streaming a conversation in both ears. It can also do that with your either directly to your iPhone, or if you are an Android user, you have an accessory like all the way over on the right that can maybe Bluetooth pair to your phone. So you can also stream your phone calls or any sound if you watch videos or anything on your phone, you can stream that sound to the hearing aids. We also have all the way over on the right some things like that little thing is a TV box. So that hooks up to the TV. You can stream the sound to your hearing aids. The TV volume can be on mute or very low for other people in the house. So there's all kinds of little accessories that might resolve an issue if the hearing aids aren't resolving hearing challenges that you're having just on their own. And then we also have this cool connectivity using our phone. So I have a couple of the apps screenshotted here. So different manufacturers, you can use your phone as a remote control to control the volume or change a program. You can geotag a location. So if you're made some changes to your hearing aid, every time you go over to see your grandkids, when you show up at your daughter or son's house, your phone will say, hey, you're back. Do you want to go into that program? And you can change it. You can change the microphone configuration. So if you were at a restaurant and it was somebody behind you was talking really loud and it was distracting, you could change the microphone configuration so it just goes forward, so it just hear the people at your table. So you can make some changes like that. One of the manufacturers has this cool thing where it gives you kind of two options where you say, do I like this? How I'm out somewhere and I'm having a hard time hearing. Does it sound better like this? Does it sound better like this? And you say which one sounds better or kind of better. And you do that a couple times and then it makes a modification on your hearing aid. And then next time you see your audiologist, they can see these changes you've made. So they're able to then work with those changes and kind of get the hearing aid sounding tuned in the best for you. And then we have even some things like this company Starkey has some artificial intelligence things going on. The artificial intelligence has ways to track our activity, our brain activity. So, how much sound were you introduced to today? Were you home alone a lot? So this might be for someone older who lives alone and you're worried about their interactions or how much walking they did today. You can kind of see that because there's sensors on the hearing aid and it connects to the app. But it also can do other cool things with these sensors and the app, and they can work together, like tying into Google Translate and having translation go into your ear. So there's some cool things that are out there technology-wise now that I don't see a lot of people utilizing, but the technology is there and it will keep evolving. So that's kind of cool. One of the cool things about that Starkey one is with the motion sensors on it is that it does have some fall detection things that can be built in and you could utilize as well. So that's one of the things with this technology. One of the best, I think, new technology things that are out there for hearing aids is the fact that we have rechargeability now. So they've been trying for a long time to make hearing aids rechargeable. That worked well, and it's there now. They have lithium-ion batteries. You have great charging. You have cases that can hold additional charges. So if you went away for the weekend, you don't even need to bring a plug. Your case can just charge the hearing aids for you for like 2 or 3 days. So rechargeability is a really great option, especially as we get older, changing those batteries when we have limited dexterity and our vision starts to go. It's really hard to change a tiny hearing aid battery. So we don't have to deal with that anymore. We can just get a rechargeable option, which is great. With that connectivity with our phone, we can now use the phone and the hearing aids tied together to do some great telehealth for audiology. So if you have someone who's homebound, or if you're a person who likes to travel all the time, you can now be connected to your audiologist back at home. And if you're having a problem, you can just schedule an appointment and they can meet you on your phone and send updates and make changes to your hearing aid via your phone. So that's really great for, a lot of people. If travel is a big thing for you, or if you live somewhere more remotely, or you're homebound and getting to appointments is challenging. And it was really great during shelter in place for people when we were having limited time to be able to go anywhere and provide services. So then I want to talk a little bit about assistive listening devices and some communication strategies. But before I move off of hearing aids, I just want to check in. I'm going to stop sharing for a second so I can see the chat and the Q&A.
What kind of hearing aid will I need if my right ear is completely gone? Ignoring this problem will atrophy the part of the brain that controls the right ear.
Okay, so I'll start with Anita's, and then I'm gonna go back to the questions previous, so the ones that make sense with where I'm at so far with the presentation. So Anita, when we lose hearing in one ear, there's a couple different options to provide sound. So if you have it's completely gone, what we would do is talk about either there's three options, I should say. So most common usually is to do what we call a cross hearing aid. So it looks just like a hearing aid that you would wear on the right ear, but it's not going to send any sound into that ear. The microphone on that side would pick up, and you would wear a hearing aid on the other ear. So even if you had normal hearing in your left ear, you would wear two hearing aids. The right side is going to pick up the sound using that wireless connectivity I was talking about and send the sound to the left ear, and then the left ear will be able to process the information. So some people can even start localizing sound. Their brain learns how to. Sometimes it can be that maybe there's a different quality to the sound. So your brain's like, oh, that sounds a little different. So it must be coming from that microphone on my right side. So we've even had people, someone's talking on that side and you can hear them. So is atrophying coming into play? That would be a really tough question for me to answer because they're still looking so much at these cognitive studies. But I think for a lot of people, it's more just frustrating to not hear anything from that side. And it sometimes can be a safety issue. So I know a lot of people that have single-sided deafness or have a dead ear and hearing loss in the other ear that wear a cross, and they really like being able to have that information coming from all around. There are also options for something called a bone-anchored hearing aid, where you wear essentially a type of hearing aid that kind of connects to the skin or the skull and gets the sound to the bone, and then the bone sends that information because you can hear through your bones. So bone conduction goes over to the ear that can still process information. And there are even some options now for someone to get a cochlear implant. So depending on why the hearing loss happened in that ear, there might be, and depending on the hearing loss, you might be eligible to talk to a cochlear implant audiologist to see if that would be an option for you. So there are some things out there. And I think it really improves your quality of life. I cannot answer about the atrophy to the brain. Personally, I wouldn't think that would be a big concern if you still have hearing on the other side. You're still getting information to the brain. Get another question pop up maybe. So another question from Janet. A good friend has hearing aids and goes to Costco for her hearing aids. She's struggling, and I wonder if she'd be better served seeing an audiologist. So that's a great question. Costco is a great option for some people. It's very cost effective, but they don't always have audiologists there. So there are some challenges also with not just the service provider, but sometimes also with the technology that's available. If it's a more difficult to fit hearing challenge, like Anita had just said, they don't have a cross option. There's nothing there for that. They don't work with people who have tinnitus or tinnitus. So there are some things that they can't do at Costco. And then with Costco, they have great options. They have great products. I'm a Costco member. I love my Costco membership, but because things are more affordable there, but you're also looking at the technology that's available isn't always the top of the line technology that's out in the marketplace. So usually their technology is 1 or 2 generations older. And even though it's top of the line, some of the features might be removed that are available in the marketplace from other audiologists. So the great thing about Costco is they have a fantastic return policy. If anybody's a Costco member, you know you can return almost anything to Costco, and that's including your hearing aids. So if that was a recent purchase and she's not happy, I would say return them. And still, even if it's not a recent purchase, seeing an audiologist, even for a second opinion, is always a great idea. And I would say that even if someone was coming to my office and they felt like they were still struggling, they weren't getting support, to see a different audiologist of mine or refer out to another place where you do feel you're being supported. I'm going to answer a couple of the questions from the Q&A. So resources for low-cost equipment. I don't know who asked that question, so I'm not sure if that equipment you're referring to is hearing aids or other hearing technology that I'm going to talk about in a little bit. But for hearing aids, I would say like lowest cost options usually are Costco. And you can also go to programs like ours that are nonprofit. So if you are in a financial situation where you have hardships, we do have sliding scale options available for people. And there are some programs out there for even like a refurbished program through the Ear of the Lion that can get a really low cost hearing aid. And then if anybody has Medi-Cal or any kind of Medi-Cal managed plan, Medi-Cal will cover hearing aids as well. And there are a few providers in San Francisco that are Medi-Cal providers, and we are one of those. So I don't know how to let you answer this question live. Maybe Tuin can help with that. So there's definitely things that are out there, and I will give my contact information afterwards so that you can reach out to me if there's more specific questions you want to find out for somebody about getting access to hearing aids if they need them. And then there are other low cost equipments that are out there for hearing, and I'm going to talk about those a little bit with this assistive listening device. Another anonymous question that had come in was, how can I afford a hearing aid, cheap, effective hearing aid? So I would say, really, when we talk about hearing aids, when you are looking at the lower cost things, like it's like with anything in life, like kind of you get what you pay for. So when you're cutting costs for technology, you do get the lower levels of technology, and that can sometimes be difficult. People aren't happy with those. So I do try to push towards more mid-level costs. And again, we're looking now at insurance coverage. So if you are Medicare and you have a supplemental plan, there should be some kind of support for you for hearing aids. Or if you're Medi-Cal, you can get great hearing aids through the Medi-Cal program. And then there's also, like I said, we have a sliding scale program. And then you can also, at most places, you can also finance. So usually have like 12 months of no interest. So that can also be supportive when you're looking at a cost that's a high cost. I really wish that we had better solutions out there that were lower cost, that were great quality, that were great solutions, but I have not seen anything really that I would recommend yet come out on the market. As we see more of these hearables, like these Bluetooth headphones that can do more, I'm hoping that we have some better options when it comes to that, but we're still looking usually at hundreds of dollars for those. And the sound quality is still questionable, I think, right now. One of the questions from Andrew was, are there any new devices that help with tinnitus? The last time I checked, I was told there was not much available besides sound machines to mask ear ringing. So tinnitus or tinnitus is a huge hearing related issue that's in the United States. There's a lot of people that have tinnitus, and there are a lot of things that you can do to help your tinnitus. We do have a tinnitus support group that meets once a month here at our office. That's super helpful to kind of talk about and get some ideas from people. One of the things that a lot of people, if you have hearing loss, a lot of people just treating the hearing loss can sometimes help the tinnitus. And then the hearing aids, almost every hearing aid now has some kind of tinnitus feature built in. A lot of the work that we do with tinnitus is some type of sound masking. Like that is the main thing that people do to help with their tinnitus. But there are other things available as well. So if you would be interested in connecting with one of the tinnitus audiologists or coming to the tinnitus support group, like that is a very lengthy question to answer. We could do a whole presentation just on tinnitus and devices and options for how to work with your tinnitus. So I hope I gave you some information that's helpful. But we could meet separately if you want to talk more about that. I can give my information. So sorry, just going back to the Q&A. Can hearing loss be related to Presbycusis? And it can. So like anytime we have a hearing loss, it can affect our voice and our voice sound quality. But I'm not an expert in that area. I would refer, if you want to get more information, I would refer probably to an ear, nose, and throat doctor first, and then maybe get referred to somebody. You can definitely treat the hearing loss, but the voice issues, you would want to see a speech therapist to work on, because it's its own disease. So you would have to get support from a speech therapist to work towards that. And someone had posted about their mom had lost her hearing in her right ear in January. Is this common? Should she get an MRI? The doctors don't know why. Well, sometimes I've seen hearing loss just in one ear a lot of times over my span of working here, and it can be related to a lot of different things. Sometimes we see that there was a virus or a viral infection that happened in the ear and it wasn't treated. And even with treatment sometimes, which would have to be within first 48 hours of losing the hearing, it's a steroid injection that would have happened. Even that sometimes doesn't save the hearing. So there's a viral infection that can happen that causes the hearing loss. If it came on suddenly, usually that's the cause of it. I would recommend if it says doctors don't know why, but I'm not sure if you have been referred to an ear, nose, and throat doctor to have that checked out, but that would be the first referral that I would go to. An MRI would be probably later down the line if they're trying to rule out certain things and they can't figure out what it is, then it might move to an MRI, like if there was maybe a growth or a tumor of something in that ear, but usually that is slow moving towards the hearing loss. It doesn't happen overnight. But again, if you wanted to connect with one of my audiologists to kind of discuss that more and get more information, I'd be happy to connect you directly to get some of your question answered better than I can. And then this was my favorite question so far is how do you politely tell people to speak slowly and clearly? And that is a great question. I have a lot of my clients who I don't know if it's not polite to say that. I mean, it is polite to say, it's not rude to say, I need you to speak slowly and clearly. Particularly now with everyone wearing masks, I think it's been a challenge for people with normal hearing to be able to understand people. So it depends. It all depends on how you feel approaching it. But most of my clients will say, I hear you better if you can speak slowly, or I hear you better if you speak more clearly. not clearly, but usually having people slow down a little bit helps. And I know sometimes, especially when I'm presenting and I'm going through a lot of information, I definitely speed up, and I often have to be reminded. And there's so sometimes it just depends on who you're with. If it's a family member or a loved one that I think it's a lot easier to just tell them. And sometimes I even have a handout that I can give that has the rules, like face me, speak clearly, don't cover your face, like these things. And you can joke around with them saying, you're breaking the rules. My parents and I do that at home. My mom speaks from another room. So we always tell her she's breaking the rules. You can't speak from another room. When it's a stranger, I think that's definitely harder to approach. So it just has to be your comfort level. But I think oftentimes if you're comfortable telling somebody I have hearing loss, they understand why you're asking that. And then they're usually a lot more helpful in trying to communicate with you. I think I might have gotten through most of our questions, and I'm going to pop back over to my shared screen so I can talk to you about some assisted listening devices. So an assistive listening device is just anything that can help you function better in your day-to-day communication. It overcomes negative effects of distance and background noise. So hearing aids are definitely considered an assistive listening device, but usually when I'm talking about these things, I want to talk more about free and low-cost solutions that are out there. So some of the things that I really want to talk about today are one-to-one communicators, amplified telephones, and alerting systems and apps. So, alerting systems, there are things out there that are, we have alarm clocks that can shake. So if you don't hear your alarm going, the shaking, we often use shaking and flashing lights in lieu of sound, because if we can't hear, we're not going to hear it unless it gets real loud. So bed shaking and flashing lights are great. We have options for the doorbell. We have options for the phone ringing. We have options for a smoke alarm or a fire alarm. And then just alarm clock as well. There are some super simple, low-cost solutions. There's a program through the Red Cross that you can get a fire alarm, smoke alarm in your house that can do bed shaker attached to it. So that's a free option. There are super high-end options, like if you have a Ring doorbell or a Nest doorbell, you can have have your phone or your watch, your smartwatch that's connected to your phone, or your phone set on vibrate, so that way you get these alerts like if someone's at your door. So if you already had that technology in your house, you can utilize it as an assistive listening device. The phones that are out there are great. There's a lot of free programs for phones, and also closed captioning. So your TV, most programs, Netflix, all these things should have captioning already built into the system. So your TV, if you go to the menu button, you can turn on the captioning. If you're watching a movie like on Netflix or something, you can go turn on the captioning. Captioning is awesome feature for anything that's pre-recorded. If you are watching live TV, you are at the mercy of the person captioning, and sometimes they're not so great. But captioning can really help to support what you're hearing, so you don't have to turn the volume up. Sometimes when we turn the volume up, it can just distort sound for us. So having the captions to back it up. And that's kind of similar to some of the phones. We don't just have amplification, but we have captioning too. So there's a program through the California Telephone Access Program through the state of California that you can get a free phone if you have hearing loss, vision loss, mobility, or memory issues. So depending on what your disability is, you could have that specialist sign off on the application form for you to get the phone, or you can just ask your primary care doctor to sign off on anything. The phones through the state are, most of them are used for a regular landline. So you'd have a home phone line already, and they're just going to provide the device for you. And that can have large buttons. It can flash. They have cordless options. They all have amplification. There's some great phones available through their program. And if you only have a cell phone, they also have some options just for the cell phone. So you don't have to have a landline. But all those phones are for an existing phone line that you already have. Then we have captioning phones available through the federal government. So there's a program through the federal government that there's a bunch of different manufacturers that are working with. I have one here, the one that's all the way over on the right, this picture. It almost is like a tablet with a phone. And these phones don't require a home phone line. They only require internet connection. So as long as you have Wi-Fi in your building, you can have one of these phones if you have hearing loss, and you can get a phone from multiple programs. So you can get one from the state, and you can get one from the federal government. And these phones all have some type of amplification built in, but then they also have the captioning available too. So the captioning can be really great if you have somebody in your life who really can't hear you over the phone anymore. Having a caption phone can make a huge difference, being able to connect with them and communicate. And there are multiple languages available on those phones as well. So these are some of the things that I love that are kind of like free, low cost options as far as alerting or assistive listening devices. There are also, did I skip that slide? Here we go. I also have some apps that I really like. Apps that can do real-time captioning for you. So if anyone's noticed today, Tune has the captions turned on in Zoom. That is amazing. It's been a long time coming that Zoom has these captions built in for us. Well, have been meeting for a year virtually. And if you find these captions are helpful to you, you might find them helpful in other aspects of your life. This Zoom has partnered with Otter, who is one of the ones I have listed here. So otter.ai is the application that they're using for Zoom, but you can also download this app on your phone and you can caption any conversation. It just uses the microphone on your phone and the captioning is going to come up on your screen. So if you want to, you can, if you need to self-advocate, like at a doctor's appointment, you can say, listen, this really helps me. I need this support. You can ask your doctor's office, I want to be able to use this. I would ask in advance so they're not surprised when you're asking to provide these services for yourself when you're in the office. So Otter is a great one. You can get up to 600 minutes a month for free using theirs. And then after that, it would cut you off unless you were paying for their service. Another great one is Ava. It's AVA. And I love Ava because not only does it just caption on your own phone, microphone here, but I could connect. So if Tune and I were together at a restaurant and I was having a hard time, I could say, hey, if I had hearing loss, I could say, hey, let's use this. We could pair our phones together via the app. And when she was speaking into her phone, it's going to show up on my phone. So if I wasn't hearing her well, I could at least be getting the captions. Would work great usually in that kind of environment with things you already have. Like I already have my headset that I use on my phone all the time. So if Tune put hers on at the restaurant, just in one ear with the microphone for the phone, see how close that microphone is to her mouth now? And she would just talk regularly and it would go. And then I could have the phone sitting on the table in front of me and I could be picking up, oh, I missed what she said, but I can look down and see the captions. So that's why I like Ava, because it gives a little bit more flexibility on the being able to connect together, like for meetings or things like that. But Otter can do it too, just directly with the one phone. There's also for an Android users, there's an accessibility download called Live Transcribe. So if you're an Android user, if you have a Google phone, you can download that accessibility app, and it does the same thing, and there's no limitations to it as long as you have data, phone data or Wi-Fi available. You're unlimited, and you have multiple languages available. So most of them you have to pick your language that it's captioning in, so it can't like go from English to Spanish to Chinese. You have to pick the language that it's going to translate that you're speaking in. But some people will use like Google Translate too. There's a way to kind of modify the Google Translate app to do something similar and also do captioning for you. So that's a great app. Both of those have free options. The sound amp or the Live Transcribe is always free. There's no cost to it at all. Then we have some others that I put up here. So that same money that comes through the federal government for the caption phones, they also have some apps that are available. So Hamilton CapTal and InnoCaption are apps you would download on your phone. You would make your phone call through the app or have someone call you on your new phone number that they gave you from that from this program service. They assign you a new phone number. So someone calls that number or you call out through the app, all of your conversations are captioned right there on your cell phone. And then GalaPro is another captioning thing that's available. So like when and if we get to start going to live performances again. So when Hamilton was in town, if anybody saw Hamilton, you know how fast all the dialogue goes, and that's really hard to keep up. So I've had clients who've used the GalaPro, they download the subtitles and then they have it available. And then there's sometimes like that's available for like movies too. If you were going to see a movie, and the screen would be black and the words would come up in white and like bounce across the screen kind of. So it shouldn't be affecting anybody in a theater. You could just have it on your lap and have the captions going or the subtitles. And then Sonic Cloud is another service that's available that kind of turns your phone or your laptop into kind of a hearing aid. So you can, you would download the app and create an account for yourself, and then you take a hearing test in the app, and you can modify the sound that's coming out of your phone for phone calls. And they have like a built-in podcast radio stations that are there that you can listen to. So you can modify those sounds to fit your own needs. So you can play with them, and it's really quite cool how much modification you can do. So if you're a person who really struggles on your cell phone, I think that would be a good app to try out. They have a 30-day trial period to see if you like it and if you're using it. And the other cool thing about Sonic Cloud is they also have a laptop download. So when you do that laptop for like, they have it for Mac and they have it for Windows. It gives you like an equalizer on your computer so you can play around with the sound that's coming out. You can see that you have access to changing like vowel sounds, sharp sounds, rich sounds, consonants. Well, so it's almost like an equalizer, but it's for people with hearing loss. So you would have this on your computer. So Zooming, watching shows, watching anything, any sound that would be coming out of your computer, you have control over it. So that's what's nice about the download for this. But they also have the app for doing the phone calls and stuff too. So if you're somebody who's struggling with sound on the phone and on the computer, and you're like, oh, it's not even worth it. I've had a lot of people sign up using Sonic Cloud, and they have they're a local company. And they have a great customer support to help with you if you struggle with technology. So I've even had the audiologist that works for them Zoom with somebody and like take over their computer via share on Zoom and like go in and do the download and help them get it set up. So they have great options for that. So, and just a couple of communication strategies that I was talking about, that list that I have, my parents and I have on their fridge for my dad and my mom. We have some of these communication strategies on there, so that it's just a reminder every day, because you know, I've been here for a long time, and every week I think I have a coworker remind me. We're Zoom calls and I'm looking away to do something on my computer, and my coworker says, I can't see your lips, you know, so I have to stop what I'm doing, turn back, because I forget I'm trying to multitask. No, don't multitask, you know, work on, make sure she can see me, make sure she can see my face and read my lips, or else she can't understand me. So, so much of our communication is visual cues, using, you know, our facial expressions and our lips. So making sure people can see your face. And that's a big challenge right now with the masks. Everyone is having a challenge with the masks. So that's where maybe we come into play. Like I was, you know, making sure I got my app ready. I'm going to use Ava when I have somebody who can't understand me. So, you know, paying attention, providing feedback, you know, this is for you as a listener, like making sure someone knows, you know, there might be a problem that I can anticipate. Like I need the captions if you're going to join a Zoom call. Like, you know, Tune has it set up and it's great because Zoom has it built in now, but whoever's hosting still has to go through the steps to set that up for you in advance. So if you're going to join a Zoom with somebody, you know, let them know, hey, the captions really help me. Can you get that set up? Taking breaks, you know, when we go a long time. I've been talking for a long time now. You guys are probably sick and tired of me because I've gone through a lot of information and we only have this short time together, but taking breaks when you can is so important too. Asking for written clues, visual clues. You know, so there's a lot of, there's like I can send, I don't know, Tune, if I can send a handout with follow-up for everybody who's attended. Besides my slides, I'm going to stop sharing here. Where
Yeah,
I have,
absolutely.
okay, great. I have a list of all the apps, and there's some new, there's always new stuff coming out. So I have it, try to have that up to date. And also the communication strategies I think are really helpful. I have kind of a simplified one. That's one that my parents hang on the fridge. And then I have one that's a little bit more complicated that gets into environmental strategies. Like, you know, I went out for dinner Tuesday night. There's a new restaurant open. I live in Half Moon Bay, and we were very excited they're back open. And we went to dinner, and they sat us right in the middle of the restaurant. And I thought, it was very busy. It was very loud. And if we were with anybody else in my life that had hearing loss, I would immediately said, you need to move our seat because I cannot sit here. We're not going to be able to enjoy dinner and communicate with each other. So sometimes it's planning to go during off times a little bit so that we know the restaurant won't be so busy. Or when you're making the reservation, to say, if you've been there before, like, hey, I'm going to need to be like on near a window or near a wall or somewhere where I'm not like right. And I didn't even know that was going to be an option for me that night, that they were going to set me right in the middle of the place. But it made for a lot of distractions around noise, and it was really hard to concentrate. And if I had hearing loss, I would not have enjoyed my dinner at all because I wouldn't have heard. So those kind of environmental strategies are things that you can think about. And that, so I have this great handout that can go through all that.
Andrew here has a question. Go ahead and unmute yourself, Andrew.
Hi there. I have a question. My mother has severe hearing loss, and we've had her checked out by ear, nose, and throat specialist. They didn't think that a hearing aid would work for her because they didn't think that they would be able to fine tune it. She's a little ADD, so she's not clear in expressing when they're trying to test her. And so they didn't feel like they could adjust the hearing aid appropriately. I'm wondering what your thoughts are on that, if this person can't really communicate as well in terms of the the fine tuning of the hearing aid. And then the other question is that she's not very technologically oriented. She doesn't use email. She doesn't use a smartphone. And it sounded like some of the newer hearing aids coordinate with a smartphone app. And so I'm sure she couldn't be able to negotiate that herself. So are there like basic hearing aids that you could use with someone who is not technologically oriented?
Yeah, so all of the hearing aids, even though they have that awesome ability to connect and do all this wireless activity, are also, you don't have to, right? They also function well and on their own. Those are just like the extras, right, that they can give us. So any hearing aid will do like a lot of automatic things and take care of everything on its own. So she doesn't have to have anything that she needs to connect with for the hearing aids to function for her. And as far as the ear, nose, and throat doctor saying they don't think they can fine tune it, I love the ear, nose, and throat doctors when they are doing the work that they do. But oftentimes they have no knowledge about hearing aids. They don't normally fit hearing aids in their office. Sometimes they have an audiologist that works for them, but usually they don't have any knowledge of hearing aids. So I would say explore that idea with an audiologist, because it's definitely could be an option. If she has hearing loss, it definitely can be an option for her. But then there's also some things like one-to-one communicators. Have you ever tried anything like that with her? Like a pocket talker? Have you heard of that?
No.
I'm going to grab mine really quick.
Vincent, we'll get to you in a moment after Jessie gets through this question. Thank you for being patient with us.
So depending on, I don't know what's happening with your mom. Is there any kind of like, she is having cognitive decline?
No, just substantial hearing loss. When I talk to her on the phone, she can hear the phone ring, but she struggles in understanding what I'm saying. And she also has substantial tinnitus.
Okay. I would definitely look into a phone for her through the phone.
One of the
program.
amplified phones.
Yeah. And then there's something like, because I have my background on. Oh, here we go. Can you see it?
Yeah.
All right. So headphones that you can put on, and then this device, super simple device, volume on and off, are turning on and off power, and then volume up and down. They're one-to-one communicators, so it works great one-on-one, right? So if I took this to a restaurant and I had all this noise going on, it's not smart enough to figure out what's noise. But if it's just someone's speech, we can control that volume. So sometimes this is super helpful in those situations. What's that?
Where can you get something like that?
Yeah, so this one, the one that I like the best is called Comfort Audio is the company, Comfort Audio, and it's called the Duet. And you can buy this on Amazon. We sell them in our office. They're about $160. I use this thing all the time. I was just looking at this one, and all my foam is coming off my headphones because I use it so much.
It looks like a simple headphones that they used to give you with the like a Sony Walkman kind of thing.
Yeah, and you can use any headphones with them. I actually, for like this, it's easy for me to just throw headphones on somebody, but like if I were using this, I actually use the earbuds probably, like my earbud, because you get a little bit of better seal.
Yes.
And so you get a little bit better sound quality. And even for some people who only have like hearing loss in one ear, you can get like a mono headphone too and just like put it in one ear. But these are great options. So you could try something like this.
So it's just like an amplifier. It's very kind of low tech, but basically they put it on and they can hear you if you're speaking in front of each other.
Yeah, and the thing I like about this one, if you get one, is when you pop the back off, there's like a little, my funny background keeps messing up my presentation to you, Andrew. There's a little, can you see this little hole back here by the batteries?
Yes.
So that's a way to like change the settings. So you pop that hole, and on the front, it's going to give you, it shows you in the directions how to do it, but it gives you like eventually you hit it like 3 times and it'll give you a little like music note.
Mhm.
And the music note is for the tone. So then you would go to like the higher frequencies if that's what your mom's hearing
Right.
loss is, and you would crank up the high frequencies. So we're not amplifying the lower, the mids. We just want to amplify the high frequencies.
Oh, okay.
And so these are great. I actually, the UCSF geriatric residents were in doing a rotation with me this morning, and we were just like, everybody was loving on these because we use them all the time. And like when my grandma got to the point where like her dementia was too much and she was having to take her hearing aids out all the time, or she was taking them out and then they were getting lost. And like, so this is super simple because it's rechargeable. You know, it's on, you know, it's working. They can control the volume. So it's like,
So you're just
sometimes-
holding up the device in front of you so that it can pick up the sounds from the person speaking with you?
Yeah, so the person would wear the headphones, and then I don't know if you can see, this cord is about four feet long,
Right.
probably on these. And then it's even got a little clip. So like if you were with her, you could even like sitting next to her, you could just like clip it on.
So just so long as the other person is speaking into that directly, it'll be picked up.
Yeah. And the microphone's right here, kind of
Mhm.
just picks up. And then I even have people who use this like for the TV at home too. Like just kind of set it on the arm of the chair and the mic's pointing towards the TV,
Oh, wow.
and then you don't have to turn the TV up so much.
Right. That's great. I've never seen that. Thank you for letting me know about it.
Yeah, you're welcome.
Jessie, we have another person who's raised their hand.
Okay.
Vincent, I hope that you're still there. Please let us know.
I didn't have a question. I think I was the one who wrote to you about Presbycusis. It was when my voice got really hoarse, I ended up seeing an ENT person, but that was the same time that I noticed I had some hearing loss. And a lot of times when I speak, I sound like I'm underwater. I do have hearing aids, but they don't seem to help all that much as well. And I've had them tuned a couple times. It's just certain frequencies I just can't hear. I can have someone sitting right next to me talking to me, and it just sounds like a jumble. And then there are times when things are just really crystal clear. I hear better when I'm outside than when I'm inside. Anyway, this has been my challenge for the last year. And as you said, everything's been compounded worse by everyone wearing a mask. And so it's been a real challenge for me to hear. And I know that visually, if I was able to see their face and their mouth move, I would probably hear a lot better. But I've seen a speech therapist that gave me some exercise to do, and doesn't seem to help much or make any difference. But when I hear people, a lot of times it just sounds like I'm in a tunnel where there's just an echoing type of sound.
Mm-hmm.
So,
and the hearing aids, and you said you've gone in to do adjustments, and that's not seemed to be helping.
Yeah, and I don't know if it's because I just don't wear them enough, and I don't wear them enough because I don't sense any improvement. I mean, sometimes I feel like I hear just as well with them or without them, so it doesn't seem to make that much of a difference.
So, I mean, that is one of the challenges about hearing aids, right? We talk about this a lot. So wearing them, because I have a lot of clients who say, well, I only wear them when I need them, like when I'm going to go out. But really, there is a lot of this component of what we call I was talking about that oral rehabilitation earlier.
Yeah. Uh-huh.
So the oral rehabilitation is really just like kind of like we're trying to retrain our brains to be able to interpret that sound better. And there are some interesting programs that are available to do some of that work. So if you want to check them out, I can give you the names of them.
Okay, yeah, I would appreciate that.
Okay, so one of them is called LACE. It stands for Listening and Communication Enhancement. And it was developed here at UCSF. And it's a program that's just an oral rehabilitation program. The captioning keeps saying ORAL, but I'm what I'm saying is AURAL. It doesn't want to. There we go. So that's the oral rehabilitation I'm talking about. So LACE is one of the ones that's been around for a long time. The program runs about $79. It's like 13 sessions that are all about 20 to 40 minutes long. So you would like you would commit to going to the gym, and you don't go to the gym once this week and then don't go for 3 weeks and go like, why am I not getting in shape? You have to like commit to the program to do it for like 3 weeks and then do it multiple times a week. And most people are getting, when they complete the program, like a 90% better outcome with their hearing aids. There's another one that's been around for a little while called Clear Works for Ears. The woman who developed that one is more like game playing. Like if you're into like video gaming, it's more like that kind of games for the oral rehabilitation. So it's called Clear Works for Ears. And there's a new option that she has out that she's developed now. That's called Amptify, Amptify. I just spoke with them a few weeks ago. I just learned about their new program, and the new program's kind of cool. It has like 4 components to it. So there's the kind of oral rehabilitation game playing, and then there's like a one-on-one expert audiologist that partners with you to kind of help you with some of your challenges. There's an educational component. So like some of the things that I talk about when I'm presenting, but they're giving you like more insight on hearing loss education. And then there's like some peer support that they're doing as well. So for kind of a similar cost, you get more with the Amptify. But if you just wanted to play the games, it's Clear Works for Ears. I think the Clear Works for Ears is like $25 a month. And the same, it's like you'd want to commit to doing the program in like a month or 2 months at the most to play all those games. But what it's trying to do is kind of like those brain training teaser games that are helping us with our cognition, a variation of those with sound as well. So it gives you these oral rehabilitation things. That might be something to look into to see if that can help kind of get you past some of those areas that are still challenges for you.
Okay, thank you.
And if you do the Amptify, let me know, because it's new and I'm trying to find out if it's going to be a great option for my clients too. We're kind of talking about that right now, trying to get more information from them.
Great, I appreciate that. I'm going to explore some of these options and see if that helps me adapt more to my situation, whether it's using the hearing aids or my new world. I mean, this everything that's been happening to me has happened within the last year and a half over the pandemic, and I'm not exactly sure if it's coincidental or what, but when my voice started to go and it was getting really hoarse, I mean, that's when I saw an ENT person, but I also at the same time I was, getting these echoing sounds in my hearing. So anyway, I appreciate the options that you presented, and I'll check them out.
Yeah. And how long have you had the hearing aids now?
About a year.
And they're your first set?
Yes.
Okay. Sometimes I like to play around with different manufacturers. I hate to say that. Your audiologist is going to be like, why did this person tell you you've had them for a year? But different manufacturers have different sound processing. So sometimes certain ones kind of match our brains better. So I wonder if like we tried a different hearing aid, if you would get a different outcome from, from that manufacturer.
Do you think it has something also to do with the fact that, I mean, I'm not wearing them all the time just because I'm not appreciating the benefits, but I've been told that if you wear them all the time, your brain will adapt to hearing things that you hadn't heard for a while, and anyway, that's supposed to all help.
Yeah.
So,
I mean, and just try. So I often like wearing, like, are you wearing them now?
no, but I hear you
So,
perfect.
so this is a great time to be like working on that oral rehabilitation, because even though you hear me fine and it's easy, it's still going to be bringing in sounds to you. Like for me right now with normal hearing, my computer fan is running, right? And even though maybe that's not a sound you want to hear, that is sound that your brain is going, well, that's a sound, ignore it. That's a sound, ignore it. So that when you're around other sounds, like maybe when there's more challenging things going on, your brain has already done like the work to know, like, I don't need to listen to that sound. I can ignore it. So one-on-one, watching TV, quiet environments, actually a good time for that brain retraining to start. And it gives your brain, like, you adapt faster than when you're out in more challenging listening situations.
Okay.
So sometimes it seems silly, right, to put them on when you're like, I don't need them right now. But
Right.
your brain is trying to capture all the sound around you.
Okay. There was just one time where I tried to wear it for 24 hours. I mean, for the full day. And I guess I'm expecting too much too soon, and I should give
Yeah,
it.
you gotta build up to it. You
Yeah,
probably want to start with a couple hours a day, and then like try to build so that you're,
Right.
putting them on, and your routine
Right.
in the morning is to put them on and then take them off before you go to bed.
Right.
And most of the time it becomes natural then for you to have them on. My dad keeps wearing his in the shower because he'll put them on in the morning and then he forgets he has them on, and then he'll go take a shower later and he keeps wearing them. Like, Dad,
Yeah.
the word.
Yeah.
So because you just get used to it, it just becomes part of you after a while.
Right.
But it doesn't happen overnight.
Right. And part of the challenge that I have though too is that I'm around the water a lot. I'm either in it or on top of it, so I don't want to have the hearing aid and have the possibility of losing it or wrecking it and so forth. So that's a big reason why I don't wear it a lot. And plus, I wear a helmet a lot too. I ride a motorcycle, I ride a bike a lot. I mean, I'm outdoors quite a bit. And so it just makes it really difficult where I have something that is, sticking on the back side of my ear. I have an Oticon hearing aid, so it hangs in the back of the ear. And as you mentioned, also wearing the mask, gets caught in the mask and so forth. So it's just like I have all these challenges of wearing something like that with my lifestyle, and so I just do it without it. And then if I'm in the quiet of my home, I can go, okay, I can wear it, but then I don't need it because if I'm not talking to anybody, or
Yeah. You do have a lot of challenges for just physically, if you're,
Yeah.
there's another style of hearing aid out there called it's like an implantable. So it's like a prescription that you do, and they put it in your ear and it stays in there until the battery dies, and then they take it out and you put a new one in. So you get them changed every couple months. It's called the Lyric, Lyric.
Okay.
That might be something to look into for yourself, because you could ask maybe to do a trial with them, because then you wouldn't have to worry about the water. You wouldn't have to worry about the helmet, the mask, it would stay in the ear. But it's a little bit more expensive because you're doing like a yearly prescription. So you're not like buying the hearing aids and now they're yours and hopefully you have them for 5 years. You're paying a yearly subscription to keep it going. But with your lifestyle, that might be a better option for you.
Okay. Well, I'll investigate that too. So, yeah, thank you.
You're welcome.
So many great questions. Jessie, you've been doing a fantastic job at really thoroughly answering these questions. The discussion is just so rich with resources. All right, Jessie, is there anything else you'd like to add before we sign off for the day?
No, just thanks for having me today. And maybe next time I get to see everybody, it'll be in person.
Absolutely. Well, this has been wonderful. Thank you so much.